Jackie lies screaming and writhing in pain as she died in her hospital bed. The nurses shut the door so they didn't have to hear her. This is Christina with the Sisyphean Journal, and today's December 3rd. Saline abortions were a horrific, nasty process that involved taking out amniotic fluid and replacing it with a strong, sterile salt solution that would eat away at the baby's skin and as the baby swallowed and breathed it in, at his internal organs. I'll provide a link below to a video that describes the process in a little bit more detail. Suffice to say, something that was able to eat away at the baby's skin didn't do any favors to the mother's uterine walls as it's worked its disgusting process for hours. 29-year-old Jackie went to Pacific Glen Hospital in Los Angeles for one of these abortions. From what I've heard from women who underwent these abortions, they were not told a whole lot about what it was going to be like. They didn't realize that they were going to feel their babies thrashing and dying inside them. They didn't realize the dangers of this abortion technique that had been abandoned in other countries before it was embraced by British and American abortionists. So Pacific Glen Hospital was a 22-bed hospital that did around 6,000 abortions a year. Sounds like pretty much an abortion specialty hospital to me. So the records conflict about whether the abortion was initiated on December 1st or 2nd. But at 11:45 a.m., Jackie was injected with the saline by a doctor whose name I'm not even going to try to pronounce. We'll just call him Dr. E. So he pulled out the amniotic fluid. He replaced it with the salt solution. And she was put in her room with, I believe, 2 other women. So eventually the baby died. Jackie went into labor. She expelled it. And 5 hours after that, her condition was really deteriorating. 2 other patients who were in the same room with her told investigators that Jackie was writhing and crying out in pain. What happened? Somebody shut the door so that the nurses outside the room wouldn't have to hear. The call button at Jackie's bed wouldn't work, so she asked one of the other women to ring for a nurse. But by the time a nurse got there to look at Jackie, she was no longer screaming and writhing. Her eyes were wide open and fixed with a glassy stare. The nurse believed that Jackie had gone into cardiac arrest, so she summoned an ambulance. When the medics arrived at 12:47 a.m., Jackie had no vital signs, and the nurse who was trying to revive her had no idea how long she'd been left unattended. The other patients, the medics, and the hospital's own records show that no doctor checked on Jackie at all after injecting her with the saline. The first doctor who even saw her in any way was one who came into the room after the medics began working on Jackie. They transported her 12 miles to Memorial Hospital of Glendale. The doctors suspected a uterine laceration, a tear in the uterus, so they performed exploratory surgery, and the bleeding was so profuse that they performed a hysterectomy as a last-ditch attempt to save her life. Jackie was declared dead at 4:25 a.m. on December 3rd. The physicians who had tried to save her life found between 3,500 and 4,000 cubic centimeters of old blood in her abdomen. An autopsy found that her uterus had ruptured. It had actually torn open during the abortion, and her uterine artery had also been torn open. She had bled to death from her injuries. Jackie's grandmother demanded an investigation. Now, the only person who knew that Jackie, who was divorced, was about to undergo abortion was her common-law husband. So this came as a tremendous shock to her grandmother and her other relatives. Her grandmother demanded an investigation and told the Los Angeles Times that nobody even told her that Jackie was in trouble until about an hour before her death, when Dr. E called to say that Jackie was in serious condition from a hemorrhage. And as the grandmother said, my son was getting ready to go to the hospital when we got another call that she was dead. The grandmother said that Jackie's brother hadn't realized that she'd been transferred to another hospital. She went to Pacific Glen, which is the hospital that Dr. E called from, and he was given the runaround. The family never found out that she'd actually been taken to another hospital until they got the bill for the ambulance ride. So the coroner held an inquest. 8 of the 9 jurors held that Jackie had died at the hands of others rather than accidentally, while the lone holdout insisted it had been an accident. Dr. Gerald Bernstein of Women's Hospital told the Los Angeles Times, quote, the patient did not receive appropriate medical care, and this was an avoidable death. Jackie should have been taken into surgery as soon as there was any sign of hemorrhage. Due to Jackie's death, and she died in 1977, and the death 2 years earlier of a woman named Cheryl, authorities announced that they would investigate how many of Pacific Glen's abortion patients were discharged home and how many were transferred to other hospitals for treatment. I haven't found any coverage of any investigation, so I have no idea if they even bothered to go through the investigation or if they just said they were going to do it. And Medi-Cal patients were referred to Pacific Glen Hospital through Pacific Glen Family Planning, which was sort of a feeder facility for the hospital. It was run by the hospital. They got referrals from the county social services office, the health office. The social workers at the county health office admitted that they had some concerns about Pacific Glen, but they continued to send patients there because their Medi-Cal insurance would pay for it. I guess any abortion is good enough. Doing a little bit of extra work to get a safe abortion is just too much bother.